Okay, today we're going to look at Parkinson's disease and the gut. And this goes for all movement disorders as well. But this is something that we've been talking about for a number of years. And now you see it's even coming out, mainstream Medscape. This is Wednesday, December 4th. The link between the gut and Alzheimer's disease and Parkinson's. How does this happen? Many people know about the gut-brain axis, but how does it affect Parkinson's disease? When we have the gut down here, then we have the vagus nerve that connects it to the brain. And there's your spinal cord. And this gut-brain axis is, of course, the vagus nerve. Parkinson's disease and other things that are known as synucleinopathies, or things that affect alpha-synuclein, those protein accumulations form in the brain, which then gums up the neuron, and the neuron can't do what it's supposed to do and dies. And if that happens enough, then you get neurodegenerative conditions. Research is looking at how that forms in the gut. It travels up the vagus nerve. A lot of times that will get deposited in the olfactory bulb of smelling. That's why you see sometimes people will lose smell 10, 20 years before they end up getting the diagnosis of Parkinson's. So the first movement disorder is, of course, the constipation. Doesn't mean everybody with constipation is going to get Parkinson's, but we want to be able to look at these things, look at their gut health, look at their gut-brain axis. Is there dysautonomia? Is the vagus nerve doing what it's supposed to be doing? Because the vagus nerve is going to control that tight junction between the cells of the gut, leading to leaky gut or hyperpermeability. We can do tests to test for alpha-synuclein, test to see is there a breakdown, just like we test for leaky gut. We can test for the blood-brain barrier, and is there leaky brain happening? Are there various toxins, chemicals, food proteins that are causing autoimmune conditions? Look at like the bacteria Streptococcus mutans. We know that that accumulates and becomes toxic in the brain, causing Parkinson's as well. So these are things that we must be doing, especially if somebody has Parkinson's or movement disorders or predisposed for dementia and Alzheimer's. But even people that are decades before that, because if we can catch it early enough, it's not just early detection, so, oh, I'm going to get that, but looking at it early enough that something can actually be done about it too. That's where it's most important.